Okay, for my head to toe assessment, I'm gonna do it on myself. Um, Before I walk into the room, I would go ahead and knock on the door just to make my presence known. As soon as I would walk into the room, I would close the curtain just to give the patient some privacy, and I would wash my hands. As I'm washing my hands, I would go ahead and introduce myself. Hi, my name is Abby. I'm going to be your student nurse today. I'm going to do just a quick head to toe exam on you. It should take no longer than 30 minutes, just assessing all the body systems. And it should be quick. Do you have any questions? And they would say no. I would identify them, just asking their name and date of birth. They'd give me their name and date of birth, and I would check it against their wristband. I would assess them for pain, so ask them if they're having any pain, and if they have any allergies to any foods or medications. So after that is all explained, I would go ahead and move on to the actual assessment. So what I would do, I would just check them for their general appearance. I would note that as they walked into the exam room, they have a normal gait. They walked in, they didn't need a walker, a cane or anything. Whenever they're sitting on the exam table, they seem alert and oriented. Their mood and affect is normal. They're upbeat. They're able to have a conversation with me, answering all the questions that I'm asking them. For their orientation, I would go ahead and ask them who they are. So I'd ask them their name, what time it was, where they were, so in the doctor's office or hospital or wherever they are. And then for the situation, I can ask them, what's going on in the world today? So they would say COVID or something like that. Just talking to them, I would notice that their speech is normal. They're not slurring their words. They're able to respond correctly to all my questions that I'm asking them. Going on, I would go onto their skin. So they're going to be in a gown, so I can see their arms, their legs, their face. If I need to check their back of their skin, I can open up the gown. So I would check and note that their skin is normal and appropriate with their race. Checking their skin tone or skin temperature, I'd use the back of my hand and go up and down their arms and note that it's warm, dry. I would note any lesions seen, infestations, wounds, incisions, anything like that. For their nails, I can check their nails, note that it's just a normal pink color. There's no clubbing, so no late signs of respiratory distress. They're sitting here breathing normally. And then they, when I do check their cap refill, I would squeeze it for about 2 to 3 seconds, and then note that the pink color goes back to normal within 3 seconds. To their head, I can just palpate and inspect their head, noting that there's no infestations or lesions on their head. There's no masses felt, anything like that. Whenever I am checking their cranial nerves, I would have them open. I would palpate their jaw and have them open and close. And as I'm palpating, they aren't having any pain. And then I'll have them clench their teeth, and they're able to do that without any pain. So that is cranial nerve 7 and 11 and 5. So when I'm also checking nerve 7, I would have them kind of raise their eyebrows and frown, and then smile, showing their teeth, and if they can puff out their cheeks, then that is a normal exam for cranial nerve 9. With the spinal accessory nerve, I would have them sit up straight and kind of shrug their shoulders and be able to move their shoulders. I can put pressure on their shoulders, and they're able to move their shoulders up still, displaying good strength. I could have them rotate their head without ease, and that shows that that cranial nerve is also intact. For their eyes, I would just visualize their eyes, looking at their eyes. There's no redness, drainage, anything like that. Their sclera is a nice white color, no signs of jaundice, and then their conjunctiva is nice and pink and moist, normal color. Whenever I'm using my pen light, I would check perla. So I would check in each eye, noting the size, shape, and how they react to light of the pupils. So shining in their light, or shining the light in their eye, I would note that the pupils get smaller whenever they have a light shined in them. So they would both react to light. They have normal symmetrical shape and size. And then whenever I'm doing accommodation, I would have them look at my pen light, and then move it to their nose and back to mine. And then for accommodation, I would have them look at maybe a clock on the wall kind of further from us and have them tell us the time. To check for the cranial nerves, 3, 4, and 6, I would have them do the cardinal gaze of direction, or cardinal direction of gaze. So I would have them follow my pen light, all of these directions, and then if they're able to do that, you can note that the cranial nerves are intact. So checking for their ears, I can use my pen light and also look into their ears and note that there's no drainage coming from their ears. I would ask them, if they're having any pain with their ears, any hearing issues. To check for cranial nerve 9, that is my one to check for their ears. So I can do the whisper test. So I would just stand behind them and I would whisper something just behind them, and then they would repeat back to me what I said. And if they can accurately say what I said, then they would have a positive whisper test. I also wouldn't necessarily have to do that if I'm having a conversation with them and I'm talking at a normal tone, and they can accurately answer my questions without any problems like that. So moving on to my nose, I can shine my pen light up in the nose and just check for any drainage, anything like that. I can check for the septum. It's symmetrical, there's no deformities. I can ask them if they've ever had any trauma to their nose or any surgery, anything like that. No drainage. I can always check for patency. So by doing that, I would just press down on one nostril and they would be able to breathe out one nostril and then check the other one. So bilateral patency. For the olfactory nerve, I can bring in some sort of scent that it would be familiar to the patient, have them close their eyes, smell the scent, and if they can identify it, then that nerve is intact. For their throat, their mouth and their throat, I would observe their lips, their gums, and their tongue. Just look for a nice normal pink color, and then a nice moist, no lesions or cracks in it. So just observing their lips, having them raise their lips and showing me their gums, and then sticking out their tongue and moving it from side to side. I could show that they have normal pink color and moistness. I would check the cranial nerves 9, 10, and 12. The 9 and 10 I would check by checking their gag reflex. So I would get a tongue depressor, have them stick out their tongue. I would put the tongue depressor on their tongue and have them say ah, and as they say ah, the uvula should rise. So that should check for those nerves to be intact. And then cranial nerve 12, I would have them stick out their tongue and move it from side to side, up and down, just to check to make sure that cranial nerve is intact. For respiratory, I would check just to make sure that they're not using their accessory muscles, so they're not, really struggling to breathe. When I auscultate their lungs, I would use the diaphragm of my stethoscope, and I would use I would have them in each section. So I would check the right upper lobe, the left upper lobe, the right middle lobe, the left lower lobe, and the right lower lobe. So I would check all 5 of those. I would just have them, you know, breathe in normal, breathe in, breathe out, and then move on. Breathe in, breathe out. So I would do every other quadrant, back and forth in a Z pattern. I would do that posteriorly as well. So I would also have them check on the back part too. For cardiac, I could go ahead and check the pulses. So I would check the carotid, so 1 at a time. I can check for JVD, so jugular vein distension. As I'm sitting there, or as my patient's sitting there, I can check for any swelling in their legs, feet, any of their extremities. I can check their radial pulses, so right pulse, left pulse. So I would just have them rest that on their leg or on the table. And then I would check with 2 fingers, avoiding my thumb. So check my 2 fingers and place it on the radial, the thumb side of my left and my right. If I want to check the rate, rhythm, and like tone of it, I would just have them rest, breathe normally, and then I would count the number of beats for 30 seconds and multiply it by 2. If there's any abnormalities, I would count for a full minute. So then I would also check my dorsalis pedis, which is at the top of my foot, along the big toe side. So more medial, I would check on there. So I check left and right. Also, while I'm down there checking their pedal pulses, I would go ahead and also check for any edema, so I can press on the top of their foot to see if they have any edema, which my patient does not. And then I would check the posterior tibialis. So that is interior. And then it's just right lateral to the inner ankle bone. So I can show you. And then you would check left and right. So for my dorsalis pedis would be the top here, and then the posterior tibialis is right here. So whenever I'm checking heart sounds, I would use my diaphragm first. So I would check aortic, pulmonic, Erb's point, tricuspid, and mitral. And again, after I use in the diaphragm, I would use my bell. So again, aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, so for my abdominal assessment, I would go ahead and just look at them from the side. So I would check contour. So it would be a nice flat, nice concave contour. I would go to the end of the bed to their feet, and I would check for symmetry. So it's nice and symmetrical. Checking for bowel sounds, I would use the diaphragm of my stethoscope. And I would start with the right lower quadrant and move with the direction of the large intestine. So I would start with my right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. And I should hear normal bowel sounds. If they're hyperactive or hypoactive, I would note that on the exam. I would palpate with just light palpation kind of all over the quadrants. I wouldn't just do the 4 quadrants. I would kind of palpate all over. So I would start again with the right lower quadrant, moving on to the right upper quadrant. I can move around to the umbilical area and then the pubic area as well. I don't note any distension or tenderness with that part of the exam. With the musculoskeletal portion, I would check the shoulders. So I can note that it's symmetrical. One isn't bigger than the other bilaterally. And then with my wrist, I would note that they are symmetrical bilaterally. So both of them are normal. I can check for my lower, I would check the hips. So I would have my patient stand, and then as they're laying, I can check, I can palpate them and check for symmetry, and then bilaterally, so both sides are symmetrical. Again, I would do that with my ankle as well, so I can check both of them. I'll have the patient sit, or they can lie down on the exam table, and I would check symmetry and bilaterally. For range of motion, I would check again with the shoulder. They have a nice contour, and then one's not like lower than the other. Again, the contour of my wrist, the contour of my hips, and the contour of my ankles. For my range of motion, I would have my patient stand up. I would have them go to the up, back, up, down, up, and then if they can move both arms circularly. Again, with my wrist, I would have them up, good range of motion, bilaterally. For my lower extremities, my hips, I would have them lay flat. I would lift one leg and use their knee. I would rotate it in, rotate it out. I would do that again on the left side. I could have them stand up and just stabilize themselves on the exam table, and they can move their leg up, back, like this, and then again stabilize, up, back, side. They can rotate their hips. And then with their feet, our ankles, I would have them lay down, or they can sit on the exam table, have them point their foot back and forth, and kind of have them rotate their ankles around. So I would check both of them. For their lower muscle senses, I would check dorsally and just kind of, I could have like my pen, something light like a cotton swab. So I would kind of brush that over their skin if they can feel that and they can sense light sensory. And then like pain, I could at the very back or bottom of their foot, I can do something a little sharper, something that's not going to cut them, but they can sense the pain and sense that they are being touched. So I can press that on the bottom of their foot and kind of move it up their leg just to check sensory. And then for their strength, again, my upper strength, I would put pressure on their shoulders and just have them move up and down. And then they would be able to move my arms with my wrist. I would put pressure, they'd lift up, and I would put pressure again, and they'd push down, side to side, stuff like that. Again, with my hip, I would put pressure here, and they would lift. Again, pressure here, lift, lift their leg, and backwards. Same with the ankle. I will, this is the ankle, I would put pressure on the top and have them push up, and then they could flex and extend. As I noted in the very beginning, they didn't need any assistive devices, so a walker or a cane whenever they walked into the room, so they have a nice normal gait. After that, that would conclude the head to toe assessment. I would thank my patient, again, assess their pain. Some of that may have caused pain, but they would tell me that they don't have any pain. Thank them for their time. After assessing them, I would go ahead and wash my hands. I would make sure the bed is at the lowest point. If they need guardrails up, I would put 2 of them up. I would lock the bed in case they needed to get up, the bed wouldn't roll, and then they would be within the distance of the call light in case they needed it. So again, I would thank my patient. Thank you for your time. If you have any questions, please let me know. If not, that would conclude our head to toe assessment. And then before leaving the room, I would go ahead and have the curtain pulled again, wash my hands, and then I could step out of the room.